ARMD or age-related macular degeneration is the leading cause of vision loss in patients more than 50 years of age and may hinder in their everyday tasks such as reading, writing, driving, etc. Hi, I am Dr. Suryakant Jha from Eterna Vision Aesthetics, Shivalik, Malvinagar, and today we will be discussing ARMD in details. Macula. The part of retina is makes the sharpest image when lights fall on it. In ARMD, this part of retina gets damaged. As the name suggests, age plays a major role in this disease. Obesity, high intake of saturated fats in the diet, cigarette smoking, high BP, and patients with a family history of ARMD are at increased risk of developing this disease. What happens in ARMD? Majority of the patient usually does not have any symptoms until the late stage of disease. So, the persons who are at risk of ARMD, as discussed above, should get themselves checked regularly. In ARMD, the central vision is compromised. So, say if you are seeing at a picture, you can see the peripheral part of the picture, but the central part is blacked out. Usually, there are two types of ARMD, dry ARMD and wet ARMD. Dry ARMD, which is a less severe one, is present in 80% of ARMD patients, and wet ARMD, which is a severe form, is only 20% of total ARMD patients. In dry ARMD, the macula gets thinner and protein gets deposited in it. We can't treat this disease, but we can slow the progression by changing our lifestyles. Antioxidants and supplements have a role to play in this disease. In wet ARMD, new vessels are developed which are thinner and weak and gets ruptured. Usually a scar is formed which causes decrease in the vision. How to know you have ARMD and what to do? Visit an eye doctor. He will check your retina to see the signs of ARMD. He may advise you some OCT scan to see the parts of retina if it is affected by ARMD. If there is any suspicion, he may advise you angiography of the retina to see the leaking blood vessels. An Amsler grid chart is given to see if ARMD is developing or not, or to look for the progression. How to treat ARMD? In dry ARMD, we give vitamins and antioxidants. We should have a balanced diet and nutritious diet. We should include green leafy vegetables and yellow fruits in our diet. In wet ARMD, we give injections in our eye which are called anti-VEGFs, which reduces the numbers of abnormal blood vessels. Anti-VEGFs had transformed the treatment of ARMD patient. Earlier, ARMD patient usually have no choice and vision loss was inevitable. But as there is development and availability of several selective anti-VEGFs, we can avert the vision loss in most of the patients if they reach in time. Some patients may need lasers after anti-VEGFs and some patients may need multiple injection of anti-VEGFs. So if you are more than 50 years of age, obese, smoker, or having a dietary habit of having saturated fatty acid, or there is any family history of ARMD, you should get evaluated for ARMD. If you have any further queries, write to our comment section and we will be happy to answer it.